curve in your neck is supposed to go forward like a smooth C-shaped curve. After different types of trauma, there's different types of stress that can cause misalignment in the neck. So you can see here, this is the first phase of misalignment. The curve actually straightens or reverses. So instead of having a nice smooth curve that acts like a spring or shock absorber and the spinal cord lays gently in here, you start to misalign the curve and you straighten it up like this, and you pull tension on the spinal cord, and you're putting extra stress on all these joints, on the disc and on the nerve roots that come out here. So instead of having this spring, you have like a rod now. So all this pressure coming down onto these discs causes disc degeneration. So this is just osteoarthritis. You start getting calcium deposition in here, you start getting a thinning of the disc. And if we look over here, this is phase 3 of degeneration. You start getting bone spurs or osteophytes. And then the last phase is degeneration that actually fuses the spine together, and there's no correction possible there. So as long as we have joint space and still move things, we can start to realign and stabilize the
And
spine.
I have joint space, right?
You do. So if we look at yours, total loss of curve in the neck. This is supposed to be going forward like I showed you earlier. And yours is actually reversing in here, but you still have healthy disc spaces in there. So if we look at that, the disc spaces, you might have a little thinning in there, but you definitely don't have any sclerosis or any spurring. So loss of curve. And then in the lateral thoracic, very straight, just like a rod here. This is supposed to be going back in this direction. People come in with all types of conditions, not just back pain and neck pain and headaches. They come in with allergies and asthma and digestive problems and reproductive problems and just so many different things. Because it's so far, this is sinking back, so I try to push it. Up and see how all the curves are gone. You are, oh, that's really down.
I'm really like sideways. I like to get a little sideways.
A little crooked, twisted.
I mean, that's what we do, chiropractors. They handle this.
I love getting adjusted. It's such a relief. Are you excited that you're going to get your back better? Yes. How's my range of motion?
Pretty good, a little reduced coming to the right. Really fall all the way over to
Crunch.
this, where the spine tips out of place or rotates out of position, or the vertebrae can slip backwards. Anytime the spine misaligns like that, we call it a subluxation, and that causes pressure and interference on the exiting nerve roots. These nerve roots come out and go to every part of your body. They go to your muscles, your skin, your organs, everything. This chart shows the different nerve levels of where they come out, and the upper cervical going blood supply to the head can affect headaches, and C2 area goes into the sinuses and allergies. This also affects blood pressure up in the upper cervical area. Go down in here, lower cervical area goes into the arms, then we start the T2 area goes into the heart, T6 stomach. As we go down the spine, the different nerve levels come out and go to the different organs and affect those organs. So if you have any misalignment, any subluxation or interference to that nerve, it can't function right. Just like stepping on a garden hose. You shut the flow of water off, the flowers are going to wilt or die, depending on how much pressure's on that hose. Same thing happens here.